I'm Dr. Kumar once again with some comments on COVID 19. COVID 19 currently, with its high infectivity, is leaving a lot of damage in its path. A lot more people are being infected, and the death toll is rising as well. There is no surprise to it. More people are infected, the more likelihood of deaths. They are bound to happen. Let's not have any other feeling about that. That should be straightforward. But the point here is, who is more likely to die of the virus? It is the most vulnerable group. And how can we protect that vulnerable group from getting infected in the first place? That's possible only if we, those who are healthy, are not infected in the first place. Because most of the vulnerable group are old age individuals, they are homebound anyway because of their comorbid conditions, or they don't want to venture out under the present setup. So therefore, if we do not take this infection, we cannot give it to our loved ones. That means they are going to be safe. In order to make my point here, let me tell you how the virus behaves and how we the humans react. Virus, mostly non-living material, but still a potent one, cannot do me any damage so long it is outside. It can be on the computer screens, my table, my sofa, my clothes, and so on and so forth. It can cause me no damage. That means when the virus is outside, the control is in my hands. Once the virus goes inside me, that too deep within my cells, I lose that control. Now, I am going to be in control of the virus. Remember, when virus is outside, we are in control. Once virus is inside, we are under the control of the virus. It means once the virus is inside us, it will hijack our machinery, it will throw everything in its path, and it will start working or utilizing that host machinery, that means our machinery, to its own advantage. That means, what is the advantage of the virus? It is going to make multiple copies. And when the cell is going to be all full of that, the cell is going to burst open. And it is going to release all those virus particles in the bloodstream, which is going to carry it from one place to the next place. That means it is moving, but it is moving not in the living room where it gained its success, but now it is going to each and every bedroom and bathroom and so on and so forth. So this is how it damages us from within. Outside, absolutely not. You can be rest assured about that. So I want you to know, virus is not airborne, it is not waterborne, and it is not foodborne. It spreads from the infected individuals. If you are going to be in close proximity to the infected individual, only then you are going to be affected by the virus. And that too is going to be dependent upon so many other factors. I'm not going to go in that detail, but just remember, if you are not around any infected individual, you cannot get it, period. Now, like I said, virus is going to cause us damage inside. That means the first route of virus entry within our systems is going to be right here. My nose, my mouth, and my eyes. So doesn't it make sense if we can block right here, we will have no need to block our neighborhoods. So I like to see Rather than blocking neighborhoods, yelling on our neighbor, let us be neighborhood watch groups. Let us make sure how the humans in our neighborhood behave. If I can block the entry of the virus over here, I cannot give it access to my inside. It does not go inside, it can cause me no damage. If I have no damage, that means my body, the internal mechanism, has no need to expel out the virus particles because in the first place, they are not inside me. So if no damage to my internal machinery, I'm not going to put anybody else's in my household or on my street or those who I happen to come in contact with in harm's way. Simple as that. So the question now is, shall we gain control over the virus or shall we just stay on the sidelines and allow virus to control us from within? That's the only question. And what we can do is by simple means, mask. That one thing, mask. That's all what is needed. So this is the one which is going to be absolute must in present conditions. So wear it completely so that it covers and it is snugly tight. Okay, this is all what is needed. Even if my hand get dirty, I happen to touch or I happen to do anything else, so what would happen? Even some particles are there until and unless I have some hand sanitizer, etc., which I encourage all of you to carry with you. So just clean it off as soon as you happen to frequently touch surfaces. Otherwise, this single piece is going to be more than enough. Now, even if my hand are infected, the only thing is if I have some eye irritation I happen to touch, there is a possibility I might infect myself. But without mask, the likelihood of me touching my face is more. And this is how the infection is spreading. So therefore, once again, let us go back to basics. So what we should be doing? Wear a mask. Double up on the mask if you happen to visit any public places where your attendance should be short one, like a public bank, like other places. If you are in the outside, single mask is going to be enough. Public places where the possibility of crowd is there, that's where the mostly likely the harm is going to come your way. Because some of these particles from the infected individual, they are going to be breathed out when he or she is exhaling. If you are in close proximity, then of course you can get it from that air around that individual within, say, 4 feet. You can definitely. Even if 4 or 5 friends are the ones just sitting on the table, just talking normally as I am talking right now. But if I am an infected individual and I'm not wearing a mask, there is more likelihood that at least 2 out of 4 will definitely get it. And then, of course, it is going to be also dependent upon the factors like how fast I'm speaking and how loud I am. And if I especially happen to sneeze, which can throw these virus particles inside me about 30 feet apart even. So just imagine, even if the individual is over there, hey, they can get some of this material, enough to infect themselves. And that too is going to be dependent upon their own vulnerability. If they are having some comorbid sort of conditions, it's not going to be good for them. So this is how the infection is spreading. And more infection, that means more likely the people are going to die. So this virus has really tested us to its limits. Our medical systems are feeling helpless. Our social political setup is feeling its effect. It seems like as if we are not any good for the fight. Fact is, we are. Question here is, shall we dare to rise to the challenge, or will we simply give the control in the hands of the virus? I would suggest please rise up to this challenge. It's a time for opportunity, not a time to play victim here. Make most of this opportunity. Wear a mask, keep on hand washing, and keep distance from other people. And whenever you happen to go inside in crowded places, make sure you double up on that mask. If all city residents do it for 2 to 3 weeks, COVID numbers will come to a halt. I can tell you this much. I'm so sure about this. And you will see the results yourself. If each and everybody, remember that, the key here is each and everybody has to do this at the same time. It's not that I am going to do it today and somebody next door can do it tomorrow and somebody else can do it the after. No, it's not going to work like that. So just a common sense measure here. Take control of your bodies. Don't give it to virus, and virus can do us no damage. Simple. Now, those 3 points, and fourth one is going to be, if you ever get any common cold, influenza, or even seasonal allergies, please do make sure you go to the nearest possible healthcare provider and seek assistance. Because what happens here is you might already be marginalized when it comes to your own immunity. Illnesses such as these, they can definitely dampen that immunity. So now, before you were okay, you could keep this virus at bay. But right now, with compromised immunity, it's an invitation to COVID as well. And COVID being an opportunistic virus as well, it tries to make its headway. Once again, headway is going to be mostly here. So please keep these things in mind. Protect yourself, protect your loved ones, and societal well-being will be taken care of itself. Do your part. God bless you all.